Well, good morning, good afternoon, or good evening, wherever you're joining us from around the globe. Welcome to this special edition of EUFOREA News, celebrating the 2025 EUFOREA Global CRSwNP Awareness Day. Now, chronic rhinosinusitis with nasal polyps, or CRSwNP, is a chronic inflammatory condition of the nose and the paranasal sinuses. It affects about 1 to 4% of the general population and about 30% of patients with chronic rhinosinusitis. Now, it's often caused by type 2 inflammation, and that means that patients often present with comorbidities, including asthma and allergies. The symptoms themselves can be very distressing indeed, and they include nasal obstruction, smell dysfunction with anosmia, continuous nasal discharge, and facial pain. And as you can imagine, all of these symptoms profoundly impact patients' lives. Now, it's true to say that CRSwNP, or Nasal Polyp Syndrome, as it's known in the patient community, remains a debilitating condition. Quite frankly, it is a condition that often goes unseen and unheard. Now, despite advances in treatment, many patients continue to experience challenges in accessing care, receiving timely diagnoses, and also achieving symptom relief. And additionally, that strong link between nasal polyp syndrome and comorbid conditions, which I alluded to earlier, such as asthma, further complicates the lives of those affected. Well, today we aim to shine a light on this condition and to foster understanding and to amplify the voices of those who live with it every single day. Now, following the success of previous shows, this year's edition of EUFOREA's Awareness Day will focus on new ambitions of care, aiming to identify and to address the issues that matter most to patients. And to really get to grips with the significance of the condition, we're joined by patients who all suffer from nasal polyp syndrome, bar one. Let me start by introducing them. From France, Chabha Djouder. She's an ambassador for anosmi.org. She's also a member of the Patient Advisory Board of EUFOREA. From Brussels, in Belgium, Mitchell Silva. He is a member of the Global Allergy and Airways Patient Platform, or GAAPP. From sunny San Diego in the United States, Jack Vielbig. He's a member of the Asthma and Allergy Foundation of America, or AAFA. From Belgium, Karina Engels. She's a member of the Patient Advisory Board of EUFOREA. And joining them from Slovakia, Veronika Meliskova. Now, she does not suffer from nasal polyp syndrome, but is an asthma patient. She does, however, sit on the Patient Advisory Board of EUFOREA. So let's now start our conversation looking at our patients' personal stories and their journeys as well, and also getting a sense of how the condition impacts their lives. Chabha, let me start with you, if I may. Now, look, we have met many times before. We've spoken before as well. I think it's fair to say that your focus when we spoke last time has been on sort of making sure that you challenge the path that patients go through. So moving from getting those first symptoms to finally, and in many cases it is finally, actually sort of breaking down those boundaries and actually arriving at a diagnosis. There are lots of hurdles that patients go through. Do you want to try and explain what those hurdles are?
Yes, sure. So my personal experience, I have to say, has been a bit different from many of the patients. Because I had symptoms coming up really unexpectedly and really hard from the beginning. I went to see my ENT straight away, and I was diagnosed with CRSwNP really quickly. However, being part of the association anosmi.org, I'm in very regular contacts with patients who themselves really struggle to get the diagnosis. So it's basically having to go through a path of going through the conditions, going through the symptoms, losing a smell, a sense of smell, sense of taste, suffering on your daily life, but going from one specialist to the other without having really a diagnosis for them.
And so for the people that you talk to on a daily basis, why does it take so long to get a diagnosis?
Well, I would say that the first explanation that I could potentially give is that people don't necessarily have access to the information. Often people also don't go to the specialist. They most probably talk to their GPs. They don't go and see the specialists. Even if they go and see specialists, I have to say that every day I talk with people who do struggle to even know what are the options available to them to treat their symptoms. So I think it's a combination of different issues.
Thank you very much for that. Jack, let me come to you, if I may. Now, your experience is somewhat different, isn't it? Because it's been marked by repeated sinus surgery, escalating surgeries. What's that been like for you? What's that journey been like? Because it can't have been easy.
Yeah, I mean, sinus problems and ENT problems in general are something I've struggled with since I was a small child. Repeated ear infections and sinus infections. And around the time I was graduating high school, I got a sinus infection that just wouldn't go away, and I couldn't quite figure out what that was. And of course, a lot of visits to my GP and ENT, and I wasn't diagnosed with nasal polyps right away. It was a kind of an ongoing thing of meeting with allergists and different doctors and trying to figure out why antibiotics and regular nasal sprays weren't working. And even the first surgery to remove them, they grew back within 3 weeks.
Right.
And, you know, I was told that was extraordinary on...
Lucky you.
Yes, I was so lucky to be the special one that had to come back so fast. And ultimately a second surgery about a year later. But it's just been, I mean, obviously surgery is a big deal, both financially and just on a day-to-day life, getting time off work, having to take 3 or 4 weeks to recover. So it's obviously unpleasant, and for me, it would be ideal if there were treatment plans that were avoidant of surgery.
And of course, as a young man in the prime of your life, the last thing you want is repeated surgeries, isn't it? Thinking, I'm different to everyone else, why me?
Of course, yeah. I mean, it's a weird kind of symptoms and disease, so to speak, to explain to people my age. I mean, I certainly had never heard of it, and I mean, obviously, even people much older than me have never heard of it, and I know that's the whole point of this all is to grow awareness for that. So yeah, it's kind of a strange thing to try and explain to my friends that I don't just have a runny nose. Like
sure. And just in terms of the treatment pathway you went through, did the surgeons just jump into surgery, or did they try other things before you went for surgery?
Yeah, so I did all of the typical treatment plans first, like biologics and testing for allergies and testing for CF and nasal sprays and nasal rinses and all that stuff. But after the first surgery didn't work, kind of the immediate course of action was, let's try another one. And the idea after the second one was, let's try a third one. And that's when I kind of put the brakes on and was like, well, clearly this isn't working, at least at this point. And I've just kind of been in a holding pattern, waiting for a new treatment option.
Okay. Mitchell, let me come to you, if I may. Now, like many patients, you also suffer from comorbidities as well. You've got asthma. That makes life far more complicated for you as well. Just tell people who are watching this, what's it like? Because, of course, it throws up more complexities for you, doesn't it?
Yeah, indeed. So my nasal polyps are actually part of a journey, actually, that started with asthma. So I was diagnosed, I think, with asthma when I was about 22. And I really noticed at moments that, okay, I don't smell. Sometimes yes, sometimes I have this sense of smell. But then, of course, when you have these short bouts of corticosteroids, you suddenly feel better, you smell, everything is okay. But bit by bit, actually, I developed worse asthma symptoms. And this is when I was also diagnosed with hypereosinophilic syndrome. Also what we see with this type of syndrome is that you also have the tendency to indeed to develop these nasal polyps. And I was actually treated for my asthma with a biologic after oral corticosteroids. But the good thing was that these biologics actually treated my asthma. But then suddenly my nasal polyps exploded, basically. It became way, way worse. So then the next challenge was, okay, what do we do to treat this?
Sure. And just what did that do to your mental health?
I I think when I compare like the asthma symptoms and the nasal polyp symptoms, I really can say that the nasal polyp symptoms for me were way worse than the asthma symptoms because it's lack of smell. Your nose is completely blocked. You speak like this. You can't sleep. You can't breathe. So it's really having a devastating impact on your quality of life. It drains your energy. I always say when your nose is blocked, your mind is blocked as well. So it's really sometimes that you realize the moment that you have these corticosteroids or biologics that work, that suddenly you smell, you breathe. It's like your mind goes open.
Thank you very much to all of you. I think you've really made the case, actually, and made that sort of people understand what it's like to have the condition. Well, this year, the theme for the Nasal Polyp Syndrome Awareness Day centres around new ambitions of care. These are crucial steps that we believe that can significantly improve the lives of patients. So let's talk about those new ambitions of care. Let me come to you, if I may, Karina. Could you try to explain to us, it all sounds very grand, doesn't it? New ambitions of care. But what exactly is it? What does it mean? How did it come about? And also, I suppose the final question is, what do you hope to achieve with new ambitions of care?
Well, it did sound very grand to us as well
when
we were discussing it. But as a group, we decided that, first of all, the patient needs education. We need to raise awareness. Secondly, the patient needs to have access to treatment and also to advanced treatment. And thirdly, and it's all linked, if you look at number one and number two, there is a need for centers of excellence. Too long, and you hear that from patient stories, people are treated for allergy, or they're treated by a dermatologist or a pneumologist, but they don't necessarily work together. So there is really a need to have a multidisciplinary approach to help all type of patients.
And I've heard that repeatedly, which is the multidisciplinary approach is vital because you can pull in expertise from all sorts of areas of medicine, can't you, under one roof?
Exactly.
And therefore you don't bounce around from different specialist to specialist and feel that you're not really getting actually the treatment you deserve.
Exactly. There should be in each country and maybe per state for the US, at least, there should be a center of excellence where really the knowledge is bundled, where patients are discussed together, because that's also going to be, you want to make treatment accessible for the patient. That's also going to be an assurance to make sure that those patients get the most advanced therapy, and that could be biological, that can be surgery, whatever it is, if those centers of excellence are created. Because as far as medication is then concerned, there the price is of course a hurdle, and there I think it's our ambition also as patients that somebody should be present in these reimbursement organisms to defend the disease and to explain how debilitating the disease really is.
I want to come back to that in just a little bit, if I may. Now, Jack, just let's pick up on some of those points, actually, there. Education. It's not just about education, is it? It's about making sure it's comprehensive. Also, it's about making sure it's actually trustworthy, that you can trust the source that you're getting the information from. And I suppose that's education about the causes, the triggers, everything to do with that. Would you agree?
Yeah, and I think for me, when I first was diagnosed, I mean, I'd never heard of it. No one in my family had ever heard of it. And it even kind of seemed like some of the doctors I was working with were not very familiar with the disease. And I think information online was pretty limited, which has since expanded in the last few years, and I'm hopeful will continue to expand. But it's also then coming to terms with what sources am I trusting online? You know, am I listening to the average Joe Schmo talk about his experience and how much stock do I put in that versus, you know, a medical website? So I think the awareness of the fact that there is education out there is not very high, and then being able to decipher what I'm going to trust and put stock in is
And just from a patient perspective, having that information for you as a patient, I assume, helps you because it helps you get into control, understand your condition, realize that you're not alone, for example, if you don't know what that condition is. So, in fact, that empowers you quite significantly, doesn't it?
For sure. And I think, I mean, I was sharing with someone last night, they're the first patients I've ever met with nasal polyps outside of myself. I'm sure they're not the first person I've ever met to have had it, but they're the first person I've met that I know has it. And I think, yeah.
How does that make you feel?
I mean, it's isolating, but it's also just kind of a strange thing to try and explain to someone.
Yeah.
Because everyone's had a sinus infection in their life, or an ear infection, or, you know, had a cold that turned into something more serious, but so few people have had to have, you know, self-injecting drugs or surgery or something of that kind. So it's often just easier to brush off as I have sinus problems and not really get into it.
Sure. Well, the good news is, building on that, the ambition for education, EUFOREA wants to ensure that patients have access to reliable educational resources like EUFOREA's patient portal, and crucially, in their own native language. Now, the aim is pretty high. It's to reach at least half of newly diagnosed patients and all patients who have regular ENT appointments, providing them with tailored educational materials. Let me just come back to you, Jack, if I may. And clearly you speak English, well, a form of English anyway. It's obviously not proper English. But how important do you think it is for patients to understand everything in their own language, as opposed to just reading things online, that you've got tailored resources, a trusted source like EUFOREA?
Of course, yeah. I mean, that's huge. And I'm lucky enough to be speaking a language that's broadly spoken across the world. And so obviously there's almost always medical information in English available to me. But I can't even imagine how frustrating that would be to try to access some sort of materials that are not native to your language.
Can I just ask you your thoughts on that? Getting information, credible information in your own language must be so much better than trying to read something in English and then translate it. As good as your English is, it doesn't quite have the same resonance, does it?
Exactly. And I noticed that there's always sensitivities that you don't pick up on. And as a patient, I think it's extremely important that you don't go to things like Dr. Google, because we don't really need that. And that's why it's so good that there's a patient platform like the EUFOREA patient platform, where you find the information and where there is a credible patient guide with scientific data behind it.
And Mitchell?
I fully agree. Like having access to information in your own language is important. We're lucky that we speak English, but we talk to patients from all over the world, basically, and sometimes it's very limited. And I'm actually happy that today we have these tools, indeed, like Dr. Google and ChatGPT. But the question is, okay, are they valid sources? And this is why the patient portal that you have developed is actually very interesting, especially if you can open it up to all these different languages. And also with technology now, with chatbots, etc., people want information individualized without giving medical advice. And I think technology now can enable this while also assuring that the resources are credible as well.
Yeah, absolutely. Chabha, let me come back to you if I may. Now, the second ambition actually focuses on the need to get rapid access to advanced therapies when they are actually clinically indicated. Why is rapid access so important?
Well, if you look at what you have to go through when you're living with CRSwNP, the quality of life really decreases. So before you have access to biologics, you have to use all kind of treatments. You have to, I mean, like personally, I've been through many research, and I have done a lot of trials before I managed to get access to biologics. Why it is so important? It's because it's a life changer. It's as simple as this. I mean, you go from, for me, it's like going from the dark side of life to getting your life back, basically.
And so when you talk to other patients, and you mentioned earlier you speak to a lot of patients, what do they say about their journeys and trying to get rapid access? I imagine it's very, very patchy.
It's very challenging. So depending on where people are in their journey, depending also in, of course, the doctors they're in relation with, it makes a whole difference. So some people, they manage to talk to doctors who are aware. So the level of awareness from a specialist point of view is also very different. And still, with biologics being reimbursed, for instance, in France, not everybody is actually recommending biologics.
So that's a really interesting question, actually, because, of course, as these new therapies come online, they're not always implemented by different healthcare systems around the world, and that poses a problem. And, of course, you've got a geographical discrepancy as to what medication you may well get. So if you had the opportunity to talk to government, if you had the opportunity to talk to healthcare payers themselves about making sure the importance is there to prioritize access to these new innovative treatments for nasal polyp syndrome, what might you say to them? And keep it clean.
Well, to be very honest, I had the opportunity to write to the Minister of Health in France before the biologics were reimbursed in France. And for me, it's as simple as this. If it's like telling to someone, there is a treatment for people, blind people, right? But you can't access it because you see a little bit of light or a little bit of colors. To me, it's the same analogy. You cannot tell to someone who is suffering from CRSwNP, who has lost so the sense of smell and the sense of taste, plus, all the nasal complications. You cannot tell to someone you cannot have access to it because of a price issue. For me, this is not acceptable.
And Karina, you mentioned something much earlier about making sure that you had a patient advocate, trying to talk to government, reimbursement authorities or whoever. If you had someone who is a patient, and I suppose this comes on the back of what Chabha just said, if you were there as a patient, because when you make those healthcare decisions, financial healthcare decisions, it's often quite clinical. But as a patient, if you sit on those boards, you can say, look, this is completely destroying my life. And so access to these drugs is really important.
Well, I think we're all in economical situations now where budgets are tight. And if you don't have access to the latest, the greatest, in between you get other treatments which doesn't necessarily help you. There's days that you maybe won't be able to go to work. So that somewhere is a bill, and you have to count all of that together. And then you have to wonder, is it worthwhile? This is going to cost 1,100 or 1,200 euro a month, or I don't know what it is in dollars, versus somebody who is on sick leave, who can't do a job, which is also an economical loss. So that is, I think, the bottom line of the entire situation. And that is something that can be expressed by patients.
So essentially having a very strong patient voice would change everything.
Exactly. I think a patient can help authorities to make that calculation and put that in the balance. Yeah.
Let me turn to you now, Mitchell, if I may. The third ambition, holistic multidisciplinary care. I mean, clearly what we need to explore here is the need for this holistic care for patients. Why, in your opinion, is integrated care, and we touched on it slightly earlier, why is integrated care so important for patients?
Integrated care is important to patients because it speeds up time to diagnosis and time to right treatment. Also in my case, for example, I think it took maybe 7 years to be diagnosed with hypereosinophilic syndrome, and another 7 years for nasal polyps. So imagine that this time would be reduced. I would have maybe access to other treatments, having less issues indeed with work, better quality of life, and maybe the effect of the corticosteroids on the body on the long term are also something that, of course, you have to take care of. And the sooner you can have access, the less damage you will do to your body.
And Karina mentioned earlier centers of excellence. Would you agree with that, that actually that is paramount?
I fully agree to establish centers of excellence. Why? Because at the end, it's about making sure you have the best care with all the specialists there, making sure you have access to innovative treatments, even in clinical trial settings. So we often forget that even if a drug is not yet on the market reimbursed, you might have the option for attending a clinical trial. And this also provides you access as a patient. And these centers of excellence can really cluster innovative research and also initiate new types of research, also considering patient-relevant, patient-reported outcomes, which will be important even more so in the new health technology regulations.
And of course, in Europe, we're dealing with different countries. Jack, just in terms of the United States, you're almost dealing with different countries, are you, when it comes to, I mean, that's the point of the United States, is actually you've got 50 very different geographical locations. How much sort of parity is there across, from your experience, parity is there across access to care around the United States? If you take up that point about centers of excellence, would it be a good idea to have 1 or 2 or 3 in every single state?
Yeah, I mean, I can't speak to my own patient journey within different states because
Sure.
I've lived in the same state my whole life. But I know, having family members and friends who have lived in different states and experienced different medical complications, obviously, and I mean, we see this on the news, there's access to different things for different people depending on what geographical part of the US you're in. So even if it wasn't every state to have a center of excellence, at least geographically, whether that be, you know, the West Coast or the Midwest
Right.
or the South or the Northeast, having something that's within reasonable travel distance and provides people with the option that's not a 6-hour flight to New York City to go.
And
get something.
just in terms of the difference in the different states, is it quite significant then, the availability of treatment?
For sure. I mean, it really depends on what sort of medical issue we're talking about, of course. But I mean, every state has their own medical laws and procedures and regulations, and doctors have different abilities. And it also depends on what types of insurance you have in the US,
Sure.
whether you have the type that lets you go directly to a specialist, or you have to go through multiple rounds of referrals. And, you know, that's obviously expensive and takes time. And so, I mean, it really depends on what sort of economic access you have and your location.
Brilliant. Thank you for the moment. So obviously you all agree centers of excellence, bringing together all the specialists under one roof is a good idea. I'm promised I would talk to you, Veronika, and this is your big moment, because I'm really keen that we get a perspective from someone who suffers from asthma here, obviously a different condition. But as someone who has asthma, you don't have nasal polyp syndrome. You've obviously heard the discussion today. How does that resonate with you and your condition?
I think there are the same needs, which needs patients with asthma and also CRS patients. Of course, access to the relevant specialist. Someone who it needs to be a person who does not treat patients with the same antihistaminics, the same corticosteroids for all the patients and without any sense. It needs to be someone who has a scientific background, who is keen on some studies and some approach, a new approach and new progressive therapies. So, and there is a need to have a balanced relationship between patient and between the specialist. Because many of us have so many comorbidities, so many associated diseases, and everything is changes. Everything is changes in time. For example, I'm currently pregnant, so there is a need to reconsider, thank you so much, there is a need to reconsider and rebuild my therapy. Because we need to think about the risk-benefit ratio, not just for the baby, and also for me as a patient. So I think it's very important to find the relevant specialist, not just for CRS patients, also for asthma patients.
And also, can I just ask you, and sort of just going back to what everyone else has said, the journey, asthma, obviously very common, we see a lot of it. Did you struggle in the patient journey to get effective treatment?
Yeah, exactly. I belong to those patients who were struggling to find the correct diagnosis in the beginning. It was around 15 years ago, but initially I was diagnosed with just hyperventilation and suspected a cardiovascular disease or something like this. And it was never ending because I experienced so many X-rays, so many, I know all the antibiotics.
So the initial diagnosis was hyperventilation.
Yes.
Did you challenge that at that point?
Yeah. It was challenging. My quality of life was a disaster because I was a young lady 15 years ago, and it was crazy. It was difficult to find a specialist who was able to give me a correct diagnosis.
Wow. And how long did it take?
It was around 3 years, I guess.
So, and also just going back to this idea of having centers of excellence, would you agree that therefore this would be a great route to go down for asthma as well?
Yes, absolutely. The same what applies for CRS patients, the same applies for asthma patients.
Okay, thank you for the moment. Well, what we do know is that the research shows that asthma and nasal polyp syndrome do frequently occur together. They can share a similar underlying inflammatory mechanism, often referred to as type 2 inflammation. Veronika, just coming back to you now, if I may. Before you joined EUFOREA, were you aware that nasal polyp syndrome and asthma were related conditions?
I can answer as a patient, I was not aware of it, but I work in clinical trials, so as a professional, I was aware of this one.
So as a patient, you weren't aware. How did you find out? So was it because of literature? Was it peers that told you? Was it clever specialists?
It was just because of my professional job. But as a patient, I was not aware of this situation.
Isn't that extraordinary? Do you think that's strange? That you hadn't been taught as a patient?
That's strange. It's crucial to have an access to the relevant information about your disease.
Well, I totally agree. Mitchell, if I may come back to you. Finally, if I may just ask you, considering sort of prevention, what role should prevention have in addressing both conditions? So now we know, obviously, the comorbidities exist together. Prevention, obviously, vital in this journey.
Prevention is vital on different levels. I think there's a level on the patient education where at the end, the more you can ask a different question to whatever specialist, it will bring you to a completely different care path. So how can we educate patients to ask different questions whenever they are diagnosed or with asthma or with nasal polyps or something that is related to a type 2 inflammation. At the same time, on the level of the HCPs as well, how can we educate them as well to see more the spectrum of all these different comorbidities?
So if I was to ask you all individually, what's your key message from this discussion? I think we've obviously seen themes coming out. Chabha, what's your overriding message that you want to give either to patients or to clinicians themselves?
Well, that would be definitely to patients. And I would tell them that they need to challenge their healthcare providers. They can't just, rely on one piece of information, and they need to challenge their doctors. Definitely.
Challenge the doctor.
Challenge the doctors.
I like it. Mitchell.
My message would be to pay more attention to the total cost of living with nasal polyps. Because at the end, it's so important. It will reflect in the reimbursement dossiers as well. It will give a much better understanding what the true impact is on quality of life, and maybe will also come or lead to new innovations to increase quality.
So not just the true cost of the drug, but the cost to the patient's life.
The direct costs and the indirect costs, such as maybe absence of work, comorbidities that will develop if you are maybe too long on certain medication. So the full picture is not yet understood. So with this, I think having a registry would be very interesting, not only tied only to a molecule, but actually across the patient journey, because there are moments when patients will switch. We have to capture how patients react on a global level to really get much better understanding.
Jack, what's your final message?
Yeah, I totally agree with what Mitchell said. I think both to patients and also to organizations like EUFOREA that are working on drugs and growing awareness for something like this, I think all these isolated symptoms and comorbidities that you live with one at a time, loss of sense of smell or congestion don't sound like that big of a deal, but when you bundle them all together and you can't smell or taste and you have a hard time breathing and it affects your sleep and there's pain, all of those things together really do impact quality of life pretty severely. And I think making sure that patients understand what they're experiencing from a medical standpoint and what medical professionals understand, like how big of a deal that is to the patient.
And what about you, Karina?
Please develop those centers of excellence. I think if you have those centers of excellence, you bundle knowledge, you bundle patient numbers, and that's going to help to educate the patient on one side, but also to educate the GP, because I think that there's still a big hole, and as a result of that, the patient has a journey that is way too long. and it takes too long before the patient has access to the right treatment.
And that's a really good point, actually, trying to improve education of the primary care physician as well. And finally, if I may come to you, Veronika, what would you say either to people watching this, to patients, to clinicians, the journey that you've been through, what have you learned and what do you want to see changed?
I would like to say just to the patients, please just believe to the facts, to the scientific progress, and not just disinformation and everything coming from the strange studies, strange organizations. So just try to believe facts and try to find such a great organization like EUFOREA. So that's my message.
Wonderful. Thank you very much indeed. Well, we have covered a great deal of ground today, and it has been incredibly insightful to hear from our patients about their personal experiences and also their perspectives on these 3 new ambitions of care. Just to recap, they are greater patient education, secondly, rapid access to advanced therapies when needed, and finally, as we keep hearing, establishing centres of excellence around the world. Thank you so much to all my panelists. Thank you to you for watching this EUFOREA debate. Now, we will be back in a few hours' time for part 2, when I will be grilling our clinicians on what we've just heard. I hope to see you then.